Hello and welcome to Talking Threads. Today we will be focusing on a very important topic, acute pediatric care and pediatric surgery, in which we will be highlighting the importance of a collective teamwork to bring about the best results for your child. Hello, I am Dr. Bipin Jose, pediatrician and a Paediatric Critical Care Expert at Zulekha Hospital, Sharjah. With me is my colleague Dr. Lalit Parida, Consultant Pediatric Surgeon at Zulekha Hospital, Sharjah. Welcome, Dr. Lalit.
Thanks, Dr. Bipin. Glad to be here and looking forward to this discussion.
Dr. Lalit, as pediatricians, we usually send and refer patients to you. In your vast experience spanning over 2 decades, what are the common conditions with which the parents bring their child for pediatric surgery consultations?
Parents usually bring for children having abdominal pain, bumps and lumps in various parts of the body, swellings especially in the groin which are suggestive of inguinal hernia or an absent testis in its normal location, and also newborn conditions where there is difficulty in eating or respiratory distress. So these are the various common conditions where parents do bring. So to top it up, it's basically acute conditions like appendicitis, inguinal hernia, undescended testis, and also tongue tie.
Great.
Since we discussed that early diagnosis is very critical in the pediatric age group and also in the neonatal age group, Dr. Bipin, how important is early assessment, especially for our early diagnosis, to catch these conditions early?
Yeah, that's a very good question, Dr. Lalit. So early and meticulous assessment, I believe, is very important to make a right diagnosis at the right time before these conditions become really crucial or critical. Sometimes complaints like persistent vomiting, severe abdominal pain which is not controlled with medications, they could be all pointers towards underlying surgical problems. So that is where the collaboration or communication between a pediatrician and a pediatric surgeon is important, which will help us in delivering care faster and in a more effective way. And coincidentally, at times parents would ask us, like, doctor, when you are saying about surgery, like adults, is there a role for minimally invasive surgeries or laparoscopic surgeries in children? What is your take on this?
Definitely. This is a very pertinent question which is commonly raised by parents, and we address their concerns in a very professional manner. Laparoscopic surgery or minimally invasive surgery or keyhole surgery, which is in common parlance, is basically we put in small cuts, half centimeter, like 5 millimeter cuts in the various parts of the abdomen to take out an inflamed organ like the appendix. This gives a bird's eye view of the entire abdominal cavity or the chest cavity, and usually these procedures are less painful, and the hospital stay is decreased significantly, and the cosmetic effect is also much better. But this is all done under the safety net that in case we do require, we can always convert to an open surgery. But most of the times nowadays, we are doing only keyhole surgery for conditions like appendicitis and undescended testis, which is especially inside the abdomen. Whenever surgery is mentioned, parents are concerned and they are kind of unsure exactly what is going to happen with their child. How do we address their concerns and reassure them in this setting?
So they come to us very anxious most of the times, but when we mention, see, these are the things which we are looking out for. So we have some of the world-class, best trained pediatric surgeons like you. Now we have a child-friendly environment which is sustainable even post-operative period. We have a level 3 pediatric critical care unit with nurses who have exhaustive experience in caring for post-op children, and also an anesthesia team which is highly experienced. So when we explain to them, see, these are the things which are going to make a difference, and which is why we are a class apart. And Lalit, one question most of the time, see, if you were to tell a parent, like, see, these are the red flag signs or the real urgent signs as a pediatric surgeon which you should never ignore in any child and which needs immediate medical attention, what would be they?
Thanks, Bipin. It is like if you have a child who's complaining of severe abdominal pain with swelling of the abdomen, which is called abdominal distension, along with vomiting, and any vomiting, especially which is green in color, is of concern. A child who's having a real hard testis along with associated swellings, or a swelling in the groin which is not going down, associated with constipation. In the newborn age group, we have a baby who is vomiting with feeds or choking on feeds and has not passed stool at all, or has an absent anal opening, or there is urinary retention, not able to pass urine. So these are the few conditions which qualify as a red flag sign for a parent to seek urgent hospital opinion.
Thank you so much for joining us on this episode of Talking Threads. It was a pleasure interacting with you, Dr. Lalit. And for any of your child's need, acute pediatric care, pediatric critical care, which is a level 3 advanced PICU in Zulekha Hospital, Sharjah, and for any pediatric surgical needs, please reach out, and our team at Zulekha Hospital, Sharjah, we are there to help you and to deliver the best for your child in your journey for a perfect health. Thank you so much. We'll see you in another episode of Talking Threads. Till then, it's bye from us.
Thank you very much.